Hey guys, welcome to Born in Faith Childbirth Education Discipling Families, hosted by Dula, childbirth educator, Mom Maria Jose. I'm excited to be here. Today we're going to talk about the labor phases, stages, what to look for, how to know you're in labor. Definitely check out my last few videos where we go over the introduction and about glorifying the Lord in our childbirth education choices. So this is where we kind of get the earthly wisdom, right? How God designed our bodies and just having the wisdom to use the interventions that are available to us in the medical field. So we're going to talk about how labor works. We're just going to do piece by piece, guys, because it's a lot of information. Okay, so stay with me, write notes. Remember, you're gonna take this to the Lord, and you're gonna start praying for certain things as you learn more. So let's get started. We're gonna have labor phases. We have early labor. So early labor is when the contractions are very far apart. They're usually very manageable. You're still laughing and talking, and early labor, you don't want to go to a hospital or call your birth team, especially if it's your first baby, too early, because you don't want them to disrupt what your body is doing in early labor, right? So early labor, your body's just starting to, the cervix is just starting to open up, it's starting to get comfortable, it's starting to do its thing. So you want to make sure you give it space to do its thing. Early labor is considered like from 1 centimeter to 5 centimeters. When they check you, we're going to go over cervical dilation as well. And then active labor, right, is when they're closer and stronger together. Usually you have to focus, and they're just stronger. So you have to focus in them. And then we have transition. Transition is when you're ready, about to pop that baby out and meet your baby. It's usually the hardest part of labor. You're usually 10 centimeters dilated. From like 7 to 10 centimeters dilated, you're already in transition. They're coming back to back. And you really need to do your breath work to get through those contractions, because they're just coming at you very intensely. And then after transition, right, you're pushing your baby, depending, that can last a few minutes to a few hours, depending if you're birthing upright, if you have the epidural, if you're at home or if you're in a hospital setting. It's all different how your baby is born. Then once your baby is born, we have the birth of the placenta. Usually in a home birth, you latch your baby and they just wait. Depending on the hospital, depending what you've discussed with your provider, they are quick to take the placenta out. Some will tug, some will put their hands in and just, and see what they can do. And then they administer Pitocin to help your body contract to release the placenta. If it's been a while, they check it, if there's been any pieces left and stuff like that. And then after that, you get your golden hour. Again, it depends where you are, because usually if you're patient, you're having your golden hour as all of that is going on and your baby's latched and all that fun stuff. So we're going to talk about internal exam, labor progression, right? This is one way they will check where you are in labor to see if you're in early labor, active labor, or in transition. So an internal cervical exam, also known as the vaginal or cervix exam, is a tool used to assess a mother's readiness for childbirth during labor. It can provide information about the cervix dilation, effacement, as well as the baby's position and the stage of labor. This information helps the birth team make decisions about what needs to happen next as labor progresses. The cervix starts to open. Right, so this is when we're talking about dilation. You're opening up. So what I showed you here, right, this cervix, that little hole right there, needs to open up to 10 centimeters so baby can be born. So from 1 to 5, they consider that early labor, and then from 6 to 10 is active labor transition. So that needs to open. Then we have effacement, right? It's the thinning and shortening. So your cervix basically needs to disappear. and it needs to be really soft so baby can come down. And this is what they're checking, right? Not E face or dilated at all, 50%, 1 centimeter, 7 centimeter is fully dilated. So that's what they're checking, right? And you can use this to your advantage depending on how long you've been in labor. If you're a first time mom, if you're a second time mom. I didn't get a cervical check at all with my third baby. I did get a cervical check by second, and I remember it being 20 hours and only being 6 centimeters and being super upset. So if it's gonna mess with your head, it's better not to do it. But they will check you if you are going to the hospital. They will check you, and that's why it's so important to go when you're in active to transition, so that they don't send you back home. Because if you go during early labor and you're not dilated or contractions are not consistent, they will send you back home. So please do not rush to the hospital when you feel contractions. Time them, see how far apart they are, feel them, feel yourself, right? Usually during early labor, you want to relax, eat, take a shower. Then, as labor progresses, right, you want to be, depending on how you're feeling, staying hydrated, snacking on light items. So, because you might throw up, but you want to make sure you're eating throughout this process. I know, depending on the hospital, they might not let you eat. So, eat before you get there. And discuss that with your provider as well, because it's very outdated information. But this is what we're dealing with. We're going through labor progression, right? So another thing they're checking is where baby is in your pelvis. I'll give you a little sneak peek so you can get a better understanding, right? We have, this is your pelvis. Baby needs to make its way down the birth canal to come out of you, right? So these are the stations they're talking about: -3, -2, right? The closer baby is. So this is what they're checking. So if baby's way too high up and you've been in labor for 20 hours, right, it's time to start making decisions. If you've been in labor for a short time and like nothing to worry about, or maybe labor stalled and you've been, right, baby hasn't moved and you've been at 6 centimeters for a certain amount of time, this is when we want to start making decisions and choices to augmentate labor, not start labor, augmentate, right? So augmentation of labor is when you need to like either be transferred if you're in a home birth after a certain amount of time that the body has not been able to birth your baby, or maybe baby's not doing good, or you're not doing good, and the midwife has to make that call. Or, you go into the hospital, but then um, labor is just not happening. So let's start you on some Pitocin, or you're not able to relax. Let's start you on the epidural and see if your body opens up before, usually the only other option is if you're in labor for way too long and your body just stops doing what it's doing, is a C-section. So this is what they're checking. They're checking the fetal station to see if labor is progressing. You can opt out of this. You don't have to do them. They usually, if you're in the hospital setting, depending on your provider, they are checking like every 2 hours. So you don't have to do that because there are risk of infection. You can swell the cervix. So be mindful about that. Pray, ask the Lord for wisdom. And uh, this is why it's important for your husband to get educated as well, right? So -5, the baby is not engaged in the pelvis at all. -2, the baby's head is 2 centimeters above the ischial spine. 0 station, the baby head is at level with the ischial spine, which is considered fully engaged. +2 station, the baby's head is 2 centimeters below the ischial spine. And then +4 to +5, the baby is very engaged and preparing for delivery, right? So we want to make sure that's where you're at. So if you have a doula, they'll put you in laboring positions to help baby get in a better position, because sometimes baby, little things can stop the baby from descending. So changing your position, making sure there are no bright lights, making sure you are hydrated and have a healthy mindset. Labor is a marathon. So the more you train your body to hold on to the uncomfortable and renew your mind and remind yourself that this is a good thing and there's purpose, the longer you will last and you will make it to the end. If you're going unmedicated, if you're going with no cervical checks, if you're doing this trusting in the Lord, trusting in what your body can do, praying over your body, having also dominion over your body is important because God gave us dominion. So knowing how to use that and like walking in that authority, super important, is super key. I used to use visuals. I would vision my cervix opening up like a flower, like a rose. That really helped me, in my body to relax and just really staying joyful, concentrating on the Holy Spirit and just praying that my body will do what it needs to do. Because unfortunately, we do live in a fallen world and our physiology changes because of we have so many toxins. So this is one thing you want to pray for, guys. I know this is gonna bless you. I know this is gonna encourage you and equip you. Join me for the next lesson. We're gonna go through the pain cycle. I hope you enjoyed this. I'll see you guys on the next lesson.